The UK becomes the first country in the world to approve the Pfizer COVID-19 vaccine for emergency use. But as more vaccines are approved, more countries are scrambling to get their own supply. And as for the U.S., the FDA scheduled a meeting to discuss Pfizer and BioNTech's emergency use authorization for a coronavirus vaccine on December 10th. Joining me now with more, healthcare expert Seth Denson. Good to see you this morning, Seth. I want to talk about the UK, first of all, and what happens there and what we potentially could learn from that here in the U.S.
Well, listen, there's not a lot of time between when they'll get this rolled out in the U.S., Will. I mean, we're planning to have this rolled out by the 12th. As you mentioned earlier, the FDA is expected to approve the vaccine by the 10th. However, we are hearing that about 10 to 15% of people will experience side effects. So it'll be interesting to hear reports coming back from the U.K. prior to American citizens getting the vaccine.
If we hear things, and I guess we're just trying to get a take on, what might make people the most cautious about getting the vaccine. And I know it's going to go to the healthcare workers here first, but if you start hearing things from the UK and maybe people have bad side effects, do you think that might impact the people who might want to get it here?
I mean, it could. Listen, we're already challenged with the fact that many Americans don't trust the vaccine. The expedient way in which it was rolled out is concerning. And so you've got about half the country here in the U.S., as a matter of fact, half the country in Britain, also saying that they're not really comfortable with the vaccine. So it will be interesting to see if reports of side effects will impact people. But, we're encouraging people that the side effects are minimal compared to the coronavirus itself.
I know there was a rush to get something out, and this administration said they wanted to have something out by the end of the year, and they were able successfully to do so. How concerned are you, though, that maybe it was rushed too much?
I'm not all that concerned. I mean, listen, the steps that this vaccine had to go through, both from Pfizer, Moderna, and the future ones that we might see from AstraZeneca and others, are very specific. This process had to go through an independent review of epidemiologists and virologists from the Data Safety and Monitoring Board. These are independent minds that are brilliant minds. They're reviewing this thoroughly. I would expect this vaccine to be a perfectly good one for anybody to take.
So that being said, and you've covered healthcare for a long time, where does that put this on the remarkable list of healthcare achievements if we're able to come up with a vaccine and get it out as quickly as what apparently is happening?
Yeah, I've long stated that our free market system here in the U.S. is responsible for 70% of the world's innovation for this reason right here, that we have the greatest minds, and when they're put to task, they get it done. They certainly have with this vaccine.
All right. Any reservations at all, though, when it comes to it and getting the distribution out and how it may be distributed here in the U.S.?
Plenty concerns on the distribution just because of the ultra-cold aspect that the Pfizer-specific vaccine has to have. That's concerning. That being said, our infrastructure here in the U.S. is well prepared to get it out. It's other parts of the world that I have some concerns with.
And how does that work globally now? Because if there are a couple of, obviously, companies now that are getting the green light, and you hope that more will in the future. But as you start to hear about it, the UK now, then in the U.S., other countries obviously are going to want to have the same thing. So what is the concern about how widespread the vaccine can become and when it's available to everyone?
That would be the greatest concern. I mean, to get global herd immunity, experts say we need between 60 and 80% either vaccinated or have contracted it. So just Pfizer and Moderna alone in a year can only produce about 2 billion vaccines. Well, in a world with more than 8 billion people, that's going to be the biggest challenge here.
Do you think that there's a concern that if people get the first dosage in one of the 2-dose vaccines, you get the first dosage, maybe you get some side effects, people won't go back and get that second one?
I have some concerns about that, specifically to the side effects and the consistency. So right now, both Moderna and Pfizer are saying that they've got 95% efficacy on this effective rate, but that's because they've got a control group. These people got the second dose appropriately. So that's my greatest concern here as we get it rolled out, is people to get that second dose. I'm certainly encouraging people to do that.
And while there was a rush to get vaccines out there, I know a lot of public officials are saying, look, let's take this with a word of caution. Not everybody's going to get this right away. General public might not see something until sometime next summer. Do you think that there's a chance that more pharmaceutical companies could come on board to help out, to speed up that process?
Absolutely. There are multiple pharmaceutical companies, not just in the U.S., but throughout the world that are working on vaccines. We're hearing more and more positive reports daily, and vaccines that are equally as effective and maybe more transportable than maybe the Pfizer vaccine that requires that ultra cold.
So do you think there's a ballpark as to when anyone who wants this vaccine, whether for travel reasons or anything else, would be able to get it?
Yeah, we're probably within 12 months, maybe even 18 months before anybody at any time can go get this vaccine.
All right, still ways to go. Seth Denson, healthcare expert, market analyst, appreciate you joining us this morning.
Thanks for having me.
You got it.